This is part 2 of PFS cure, okay, how to overcome post-FINASTERIDE syndrome. This is what you can do. This is some slight overview about post-FINASTERIDE syndrome protocol, even PSSD or PAS, and combination of all of these, okay? So in this video I will talk about androgen receptor silencing, androgen receptors sensitivity, overexpression, and so on, okay? And why even if you are using, okay, so even if you are using things like DHT cream, proviron, boldenone, and so on, you will not get the results, okay? I will talk about also DNA methylation, okay? And honestly, how will you know that you have androgen receptor silencing, okay? So is low free alpha HSD a sign of androgen receptor silencing? Okay, so till now you only knew that, for example, if you are blocking 5-alpha reductase activity, okay, like in PSSD via too high prolactin or estradiol, okay, or serotonin, okay, in PFS via directly via finasteride effect, okay, or dutasteride, okay. No one is talking about free alpha HSD, and yes, low free alpha HSD activity is linked to androgen receptor dysfunction, okay. So maybe it's not the direct marker, okay, but this will show you really accurately if you have any androgen receptors dysfunction, okay. So free alpha HSD converts DHT into free alpha androstenediol, free alpha diol. I had already video about this in the past, okay. And this is important neurosteroid, okay. So guys, allopregnanolone alone is not the only one, okay. So even things like free alpha androstenediol are important, okay. So allopregnanolone is not only the cure like everyone will try to tell you, okay. So free alpha diol is known to modulate androgen receptor activity and interact with central nervous system, okay. So, and if this level drops, okay, it might lead to reduced AR activation or sensitivity issues, okay. In PFS, okay, like I told you, even in PSSD, finasteride inhibits 5-alpha reductase activity. This is leading to lower DHT. The same for PSSD, okay, so because of the high prolactin, your 5-alpha reductase activity is affected, okay, and this is also disrupting the free alpha HSD pathway, okay. So, and this chronic DHT deprivation will cause R signaling, okay, because look, some guys, they are using DHT derivatives, okay, and they see no effect on androgen receptors. Why it is so? Because there must be something different, okay. So if free alpha HSD remains low, okay, after post-FINASTERIDE syndrome or after PSSD, post-SSRI sexual dysfunction, okay, you are maybe struggling to restore normal androgen metabolism and neurosteroid production, okay. Like I told you, okay, low free alpha diol, free alpha androstenediol glucuronide indicates low free alpha HSD activity, okay. Symptoms, okay, so definitely low libido, anxiety, depression, cognitive issue, because I see guys with normal levels of allopregnanolone and they still have issues, okay. So this guy have, for example, if you have this issue, then you will see no effect of DHT therapy, even no effect from testosterone cream, okay, because androgen receptors might not be responding due to low downstream metabolites, okay. So that's the issue, okay, because I work with many guys and they tell me, okay, I have used DHT cream, I have used proviron, boldenone, I don't know what, and things are not working. And this is the reason, okay. So silencing of androgen receptors via low activity of free alpha HSD, okay? So, and what are these? You have free alpha and free beta metabolites of DHT, okay? So, androstenediol, free alpha diol, okay, free alpha androstenediol, glucuronide, okay, so they help with GABA A receptors activation, okay, so stress and anxiety, okay, they enhance libido, okay, they support mood stability and antidepressant effect, okay, so low free alpha diol G has showing us reduced non-steroid activity, higher anxiety, depression, libido loss, okay? This is why some PFS sufferers experience severe anxiety and anhedonia, the same for PSSD, guys, okay? If you need my help, you will find a link in the description, okay? We have also free beta metabolites of DHT, androgenic, they are potentially negative for mood, okay, so they bind to estrogen receptors beta, they may counteract excessive AR activity in some tissues, okay, so high free beta diol might contribute to estrogen-like effect, okay, and they are lowering libido, okay. What you can do, okay, how you will find out if my androgen receptors are working or not, okay, so you can take blood test, okay, and in this blood test you can test for free alpha androstenediol glucuronide, okay, DHT level, you can do touch test, okay, so, and you can measure DHT metabolites, free alpha and free beta androstenediol, okay, so it provides insight into overall androgen metabolism, okay? So if you really want to know, are my androgen receptors silenced, overexpressed, not working, if there is any dysfunction, okay? Then you can try this, okay? And if you already tried DHT like Proviron or Boldenon and this is not working, okay? Then probably your androgen receptors are silenced, okay? So yeah, so this is what I want to tell you, okay, so yeah, there are many things, okay, that can help with this, okay, but also let me show you epigenetic restoration, okay, also one way, just a second. Okay, so also I had one client and he came to me, and when I take a look at his protocol, I saw it immediately that he will not heal anytime because he took some protocol from YouTube video. I will not name the protocol, but it's, you probably heard about this protocol many times, okay, so I don't want to give advice on this. And he's using high doses of testosterone, HCG, okay, but really high, and estradiol is completely in the skies, okay, so also I want to tell you about AR desensitization. Why wouldn't Boldenon, testosterone or DHA work, okay? I already told you about free alpha SHD, okay, and what you can do, okay? So generally, guys, think about this. Boldenon, why it should work on androgen receptors, okay, even blasting. Why? Because generally Boldenon is more anabolic and less androgenic. DHT has stronger effect on androgen receptors activation, if, okay, so DHT has the lowest effect, okay, then we have testosterone, okay, then we have Boldenon, okay, and probably the biggest effect would have Proviron, but or any DHT derivates, okay, but it doesn't work like this, okay. If androgen receptor is downregulated or silenced epigenetically or otherwise, like DNA methylation, increasing androgens won't necessarily restore function, okay? So, and DHT is the strongest natural IR agonist, okay? So, Yet even DHT-based treatment like Proviron or DHT cream don't always work in PFS. Regarding DHT cream, guys, it doesn't mean that you have sky high DHT that it helps somehow, okay? There should be always proper ratio, like testosterone to DHT 10 to 1, 5 to 1. Anything lower is bad, okay? So, and I see many guys flexing like with I don't know, 500, okay, nanogram per deciliter DHT. It's crazy, guys, it's crazy, okay? So 10 to 1 mean, okay, if you have a 1000 nanogram per deciliter testosterone, your optimal DHT level should be like 100, okay, maybe 5 to 1, 200, okay, so not more, yeah. So 500, if you have 1000 testosterone, 500 DHT, it's crazy. It can also down regulate androgen receptors, okay? So guy, and if you apply this directly on your penile tissue, it's like testosterone cream, okay? If you apply testosterone cream on your balls or penile tissue, you will also have a high DHT, okay? So this is one of the way. If your androgen receptor, if you don't have any dysfunction, maybe lower activity or 5-alpha reductase is not working as it should be. For example, if you use normal dose of testosterone cream, it will raise your androgens, it will raise your DHT, and in a few months you can already see results, okay? This is one of my clients that did something like that, okay? But you really need to know what you do, okay? So always talk to a doctor or someone who has already experience, okay? So don't just try something without even proper blood test, okay? DNA methylation, okay? DNA methylation, if you address this, you may help reverse epigenetic silencing. You can again reactivate IR expression, okay? So the same you can do probably with HDAC inhibitors, but from my experience, I don't see many guys that really have that kind of issue, any resolution from taking HDAC inhibitors, okay? So they have some help for mental issues, okay, but not for things like ED and the whole androgen metabolism and so on, okay? So HDAC inhibitors, we know some of them: sodium valproate, sodium butyrate, trichostatin A, this one cancer, okay, curcumin, but with curcumin I have a problem that is 5-alpha reductase inhibitors, okay? So what I would also try to do, I will try to do naturally, I would naturally address DNA methylation, okay? But also you need to have other things in stack, okay? So that will affect on 5-alpha, that have a positive effect on 5-alpha reductase enzyme and so on, okay, guys? Because you can use alpha ketoglutarate for DNA methylation, okay, but you also need to have other things, natural supplements that can support this, okay? So that will support 5-alpha reductase enzyme, that will support, for example, IGL-1, because IGL-1 also supports 5-alpha reductase enzyme. You need to address inflammation, because I don't know if I was already talking about inflammation, like higher level of IL-6, CRP have inhibitory effect on 5-alpha reductase inhibition, will inhibit 5-alpha reductase enzyme, okay? So inflammation to fix, it's really crucial to address oxidative stress if you want to fix your ED, for example, okay? Tribulus, why is not working for AR dysfunction? Guys, first of all, some of guys I see, they have low LH, and Tribulus is very, very good at that, okay? So it can increase LH, because I had one client and he was trying to get off TRT, and we have been using Tribulus, okay? Tribulus cycle to help him get off TRT, and it was older patient and he was able to get off TRT, okay? We also use 2-3 other supplements, but Tribulus was part of that. Bulgarian Tribulus, high quality. Okay, so can help increase testosterone a little bit. Tribulus, especially in guys where there is a low testosterone. Okay, in younger guys where the testosterone is quite okay, there are not so many things Tribulus can do. The one most important things that is helping PFS guys, and this is really crucial because PFS and PSSD, they are affecting 5-alpha reductase. Okay, it up-regulates 5-alpha reductase enzyme, so you have one thing that you can address, okay, with natural thing. Okay, so it's not only epigenetic. You have 5-alpha reductase enzyme, 3-alpha HSD, androgen receptor dysfunction, but you need to test. You have prolactin. Tribulus is great for prolactin, okay, so you need to try. If Tribulus is not working for prolactin, you need to add more things to the stack. Don't go too high with P5P or something, it will not work, okay? So, IGF-1 the same. Some of the guys, if you have a normal IGF-1 level, it means that also your 5-alpha reductase at least is working, okay, somehow. But it would be good to confirm blood test with Dutch test, okay? So take a look at your IGF-1 level, DHT level, and compare this to 5-alpha reductase activity, okay? Proviron can help if you have androgen receptor polymorphism, okay? But if you have silenced androgen receptors, probably it will have no effect. But Proviron, mesterolone, is the one that has this unique property. It binds strongly to androgen receptors. If you want to increase DHT, okay, without, for example, your 5-alpha reductase enzyme is not working so good, okay, at the moment, you can use Proviron for that, okay, if that's only the issue, okay, but it's not solo therapy because it can also block estradiol and it can also decrease SHBG, okay, so if your androgen receptors are severely desensitized or silenced epigenetically, it will probably not work, okay? And why would DHT cream on PL tissue not work, okay? Even penile tissue has own androgen receptor insensitivity, okay? And flooding it with DHT will not help, okay? So even blood test might show you high DHT, but androgen receptors are not responding. Like I said, here probably DNA methylation or increasing the metabolites of DHT 3-alpha metabolites, okay? So what I don't like for DHT cream is the DHT to testosterone ratio. There are some guys on Twitter, I will not name these guys, but they are you should use testosterone cream, DHT cream, 20% DHT cream, on top of that HCG, okay? So you will not keep the normal testosterone DHT ratio, okay? So DHT cream can shift it to 2:1 or even 1:1, and this is very unpredictable. You can have really bad issues, okay? So you can urinate a lot, lose a lot of hairs and so on, okay? So it's not normal to have such a super high level of DHT, okay? So like I said, if you try something, do test afterwards to see what is going on. Sometimes even DHT cream will skyrocket your, sometimes even testosterone cream will skyrocket your DHT, okay? So yeah, guys, so that's it. So this is part 2. Let me know what you think. I try to give you as much information as possible. Bye.